Hello everyone, this is Dr. Shishma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about what is the connection PCOS has, it makes this metabolic syndrome worse, and also it can trigger the metabolic syndrome in people who do not have it. How? It will trigger the abdominal obesity, it will trigger high BP, it will trigger high blood pressure, it will trigger cholesterol formation. How? With insulin resistance. Insulin resistance is one of the key factor in PCOS which will trigger the metabolic syndrome. You have to understand, if you have seen our older videos, you would be understanding that PCOD and PCOS are a little different from each other, and in PCOS there is a symptom called as prominent symptom called as hyperinsulinemia or insulin resistance. That hyperinsulinemia and insulin resistance can trigger this metabolic syndrome. Apart from that, PCOS also constitutes of hyperandrogenism, which is increased in DHEA or increase in your testosterone level in the body. That can also trigger BP or blood pressure. And apart from that, you know that PCOS people usually, if there are 100 people who are suffering from PCOS, 60 members of people who are suffering from PCOS do suffer from obesity, right? They can change their shape, and they can either shift into an apple shape or an enlarged pear shape, not a normal pear but an enlarged pear shape, with this abnormal deposition of fat in the lower abdomen and in the thighs and in the buttock region, or there is abnormal accumulation of fat in the upper abdominal area, which will give rise to the apple shape. So you have all of these symptoms connected to PCOS. Now, how are these causing this metabolic syndrome? We will be letting you know. And you have to remember that there is sympathetic system activation because of hyperandrogenism in PCOS. It all seems a little bit, off the shore, or it seems a little bit confused, right? So let me explain to you in detail how PCOS is causing or is triggering or is maintaining this metabolic syndrome. You know PCOS, right? So what does PCOS stand for? It stands for the pie category, which is polycystic ovaries, irregular periods, and excess androgen. So we have first one is excess androgen. Apart from that, because it is a syndrome, it has insulin levels increased insulin level or hyperinsulinemia, which has insulin resistance. Fine. So these two are the culprits. So what happens exactly? Insulin is supposed to make the blood sugar level go down, because it is like a gateway through which the cells consume the blood glucose level and they utilize it for their day-to-day activities. But whenever there is hyperinsulinemia or insulin resistance, why is it happening? Because in PCOS, what happens is, usually if this is the lock, this is the cell's lock, and insulin is the key. It opens up, glucose goes in, and the blood glucose level comes to normal. But what happens here in PCOS is, there are other antibodies which are acting, or other molecules in our body which are acting like insulin. They will go and they will, attach with the lock. They will not open the lock, they will not close the lock, they will just attach. So that insulin is blocked here. So there is no blood sugar which is getting lowered, because there is no blood going into the cell. First mechanism. Second mechanism, insulin is the same. The receptor is also same, but this little molecule in the receptor has changed. So this lock is not working now. So there is insulin level is increasing in the body. Why is it increasing? Body is thinking, because there is low insulin, the blood glucose level is spiked up. So we have to increase the insulin so that the blood glucose level will go into the cells and it will come down. But here the problem is not with the insulin, the problem is with the receptor. The problem is with the changes that are happening because of PCOS in the receptors, right? So there is increased insulin, there is increased blood sugar, but the cell is not able to use the blood sugar. So what will happen? You will have sweet craving, because body is thinking that there is no enough sugar for the body to run. There is no enough of ATP to run. So what it happens? It gives you sugar craving. It gives you fat craving. It gives you this craving where you consume a lot of simple carbohydrates. Whenever you're consuming simple carbohydrates, blood sugar level is already increased, and it will furthermore increase. Insulin is already there, but it is not able to open. So the body will think insulin is less. So it is triggering again insulin. So there is lot of insulin, lot of blood sugar. What will happen in that condition? Insulin resistance condition, what will happen is that, see, insulin has other properties also. It will help in formation of fat, okay? And it will help in formation of fat, and it will not allow fat to be broken down, or it will not allow breakdown of fat. So it is helping in formation of fat, it is helping in not breaking the fat, and it will help this adipose tissues to become hypertrophy, okay? This small adipose tissue, which is supposed to be 1 centimeter, is becoming 10 centimeters. I'm just telling you, otherwise, I mean, like, it is not the exact measurement. So what is happening? The fat is being stored. The fat is not being broken down. The adipose tissue, which is supposed to be this much, is becoming hypertrophied. Apart from that, what is happening? Insulin, along with this androgen level, they will trigger the sympathetic system, so that usually blood vessels which are carrying the blood usually dilate, they relax, okay. But sympathetic system, whenever it is activated, they constrict, right? Whenever they are constricting, what happens? Blood pressure rises. So what are you getting here? You are getting, there is decrease in good fat because you're not consuming anything healthy. There is increase in triglycerides because you're consuming sugars and bad food. There is increase in abdominal fat because of the fat storage, and there is increase in BP, which because of the hyper androgenism and hyperinsulinemia. So all of this will cause or will constitute for metabolic syndrome. So what is there? HDL is there, triglycerides are there, and then you have the fat which is being deposited, you have the hypertension, and you have the fifth feature, which is increased blood sugar, which is there already because the blood is not being utilized by the cells. So all of this will constitute for the formation of metabolic syndrome. Many people are suffering with metabolic syndrome, they just don't know they are suffering with metabolic syndrome. They don't know that there is a tagline given to the symptoms that they are suffering with, right? So if you understood how PCOS will maintain it, will trigger it, and will help in not losing weight. PCOS, if you're having a PCOS and insulin resistance, you know that insulin, whenever insulin is there, you're not supposed to, or it will not allow in fat breakage, right? So that is why even if you're cutting down the calories also, you're not losing as much as weight as you're supposed to lose because of hyperinsulinemia. If you're someone who's suffering from PCOS, PCOD, or any other female reproductive organ diseases, Fidicus Homeopathy is the answer. Here we have two kinds of consultation options. One is the online consultation option, and the other one is in-person or the offline consultation option. If you're someone who's staying nearby the nearest branch of Fidicus, you can contact us in person. Or if you're staying far away from us, you can contact us online through audio consultation option or through the video consultation option. Once the consultation is finished and your investigations are verified, especially to the online clients, medicines will be door delivered to you. If you're staying in India or any state in India, you will be receiving medications within 3 to 4 days. If you're staying in USA, 3 to 5 days, and across the globe anywhere else, it will take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us, or message us. And if you'd like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from PCOS, PCOD, bulky uterus, dysmenorrhea, fibroids, or any other female reproductive organ diseases, Fidicus Homeopathy is the answer. Why is Fidicus Homeopathy the answer? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 important principles. First of all, we are experiencing good success rate in people who are suffering from PCOS, PCOD, bulky uterus, fibroids, dysmenorrhea, cervical erosion. The success rate is really good. And apart from that, the transparent treatment here at Fidicus Homeopathy. There is no grey area between the patient and the doctor. The prognosis is clearly explained to you. And personal care here at Fidicus Homeopathy is top notch. Any sort of queries or myths, any sort of doubts that you have will be explained to you very clearly. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.